Hi, everyone. Okay, it's your nursing tutor again. I'm in the CSS, back in business over here. So if you need some tutoring, come and see me. I'm in W182 in the building. What I'm going to go over today is meds, neuro meds specifically. And this is going to be a little bit of this and a little bit of that. It's going to be a little bit all over the place, but these are my silly ways of remembering some of the medications. So I'm going to start with seizure meds. So a lot of times students remember Dilantin. Dilantin is a trade name though. So your NCLEX and your standardized testing proctored exams are not going to say Dilantin. They're going to say phenytoin. So here's my way of remembering phenytoin. Phenytoin prevents seizures with phenytoin because you don't want any more. So the any, phenny, and any, I know it's cheesy, but when you don't want any more seizures, use phenytoin, phenytoin. That's that one. Listen, I told you they're cheesy. So another medication profile that you're going to need to know about is when somebody's having a seizure, like that it needs to be stopped. So for example, if somebody's having status epilepticus, that is a medical emergency. So you need to stop those seizures in their tracks. So Pam and Barb stop seizures. So lorazepam, diazepam, phenobarbital, Pam and Barb, they stop seizures in their tracks. Okay, those are the seizure meds. On to, let's do some stroke stuff. Okay, so if you've determined that you're going to treat an ischemic stroke, you could give alteplase, TPA. So alteplase needs safety things in place. So alteplase with the ACE there, you need safety things in place. So you need to make sure you check their blood pressure, that it's not too high, nothing over 185, over 110. You need to check with the CT scan to make sure that they are not having a hemorrhagic stroke. You need to check to make sure it's within a certain time frame, nothing more than 3 hours. And check their patient history. So if they have a bleeding disorder, or if they're pregnant, those type of things, you really need to make sure that you check in advance. So safety things in place with alteplase. Those are your clot, that's your clot buster. Here's my heparin thing. So heparin has a P in it. The antidote starts with a P, protamine sulfate. Pork considerations. So if they have a pork allergy or if they have a pork cultural or religious concern, they shouldn't be having it. And heparin can cause the adverse effect of thrombocytopenia. So remember the P theme here, and that might help you with heparin. And as a side note, I don't have a little extra one of these, but coumadin and warfarin, coumadin, the antidote for that one has the K sound. So vitamin K is the antidote for coumadin. Okay, so for spinal cord injuries, if your patient starts to have spinal shock and they start to have really low blood pressure, you do want to show up for hypo. So do show up for hypo. So dobutamine and dopamine is your do part. Show is your shock. Hypo is your hypotension. So that might help you remember that. And that's not just for spinal cord issues. If you're in shock, you do need to show up for hypo with these two meds. Also, for spinal cord injury, sometimes our patients get really spastic muscles. So Dan got back to normal with no spasms. So Dan, for dantrolene, got back to normal, baclofen. So Dan got back to normal with no spasms with dantrolene and baclofen. Dan got back. Okay, Now we're going to talk about two more. So these are more for the neurological disorders. So if you have a patient with ALS, remember the ice bucket challenge that we did on social media all the time? We were like constantly waiting to get called out on our Facebook or Twitter or whatever to see who was going to call us out so we could do the ice bucket challenge, so we could donate money to ALS research. So that's, I bring that up for a purpose. So the ice bucket challenge made us glued to our technology, to our tech. So the med is Rilutek, or Riluzole is a generic name, but Rilutek is an anti-glutamate. So we were glued to our technology waiting to get called out for the ice bucket challenge. Rilutek is an anti-glutamate, glued to our technology. The last one here, everybody learns about the Tensilon test for myasthenia gravis to determine, am I having a myasthenic crisis or am I having a cholinergic crisis? Because they're hard to tell apart. Well, Tensilon will not show up on your boards. Tensilon will not show up on those proctored exams. So here's my best way of helping you remember about this. So you need to phone a friend to determine if you're having a myasthenic crisis or a cholinergic crisis. Edrophonium to phone a friend to get help to figure out what it is, what it isn't. So I know those were corny. Corny helps you remember things sometimes though. So hope that helps. Have a good one.